Good afternoon, colleagues, and welcome. My name is Imran Chowdhury. I'm the Director of Public Health at the London Borough of Sutton, and I'm also the SRO for the Good Thinking programme. And we're really pleased to have so many of you give up an hour to spend with us this afternoon for this webinar. So here at Good Thinking, the project team is so passionate about creating great digital content, which is really relatable to the needs of Londoners who are struggling with mild to moderate mental health conditions, particularly those common ones such as anxiety, stress, low mood, or sleep deprivation. And we've been on a fantastic journey over the last few years, and particularly during COVID, learning about how to reach out to Londoners digitally, how to create content which is really meaningful, but also how to work hand in glove with some of our more disadvantaged communities to make content which is bespoke and meaningful to them. And I think, but all of that is really not meaningful without people like you. So whether you are a primary care professional, a GP or a nurse, a health visitor, a social worker, a social prescribing link worker, we're going to find a little bit more about you later on, or indeed a community champion. Actually, yourselves as colleagues on the front line, you're the people who've access to the people who need help to get help. And so we're really thinking about you for this webinar today. And what we want to do in the next hour or so is really show to you some of the fantastic resource that we've built on Good Thinking, have some discussions about how you could use it in your day-to-day practice, but also think about maybe a little bit about how your system or your area of work could use this systematically. So we want this to be a really interactive webinar. So there's a chat function. So please, throughout the talks, whenever you've got a question or thought, just please feel free to pop those down in the chat. We'll try to answer them as we go along, and we'll also hopefully have some time for Q&A at the end as well. And then before I hand you over to the fantastic people who really do all the work, I just want to set you one additional challenge. So as well as thinking about what good thinking can mean for you, please also think about your colleagues in your wider system who aren't here today and who it might be useful for you to disseminate some of the materials we'll send out after the webinar too, because we'd really like to get the message to most of our colleagues across London about what this platform can do. So without any further ado, let me hand you over to the program team, and I'll hand you over to Gemma, our wonderful director, first of all. So Gemma, over to you.
Thank you, Imran. So yeah, you can see on the screen a list of some of the people, some of the fabulous people in the team who make good thinking possible. And we're going to start today by taking some time to also find out about you. Nicola, do you want people to use the kind of the coder on the Q code to...
So if we do a round of introductions first, then we'll go to the exciting part of using the QR code and keeping my fingers crossed that the technology works.
Okay, so on the panel today, you've got Imran Chowdhury, who's just on your introduction. He's Director of Public Health at the London Borough of Sutton. Myself, Gemma Gilbert, I'm a Director of Transformation at Healthy London Partnership. And Healthy London Partnership is the delivery unit vehicle for good thinking on behalf of London's system and behalf of Londoners. We've got Jess Simpson, who is the kind of head honcho of that programme within Healthy London Partnership. She's the Senior Programme Manager at Good Thinking. Richard Graham, who was really there at the very start of Good Thinking. I'm going to talk to you a bit about the history in a minute, but was one of the people who inspired the whole Good Thinking idea and the need for it for Londoners, and he's going to tell you more later on about what's in Good Thinking. And also Nicola, who's with us. She's a project manager here at Good Thinking and has helped us put together this session today. So thank you to Nicola.
Fab. Thanks, Gemma. So now's for the exciting part. So obviously on the screen you can see a QR code as well. So as Gemma and Imran mentioned, we want to make this as interactive as possible. So we've got a couple of questions. There's some more fun ones and some serious ones as well. So great, thanks, Yassine. So Yassine's just flashed up now on the screen. So if you can either scan the QR code, or if you visit www.menti.com and enter the code that you can see on the screen as well, then that will take you to the right place. So we can see that a few people are joining. if you do have any problems, then again, feel free to drop something in the chat pane, and we'll do our best to help. But I can see there's quite a few people joining. So I'm assuming no one said anything. So I'm assuming that there's nothing in the chat pane. So we'll probably. Can you add the code to the chat? Yes, we can add a link to the chat pane. That's absolutely fine. Bear with me while I do that. There's a link also gone into the chat pane as well to help people. Got quite a few people joining the Mentimeter now as well. So I think without further ado, if you're just getting there, that's okay. But we can maybe start, Yassine, by sharing the first question. So if you go on to the next slide, so either on a smartphone or your monitor or laptop. So we've all been, unfortunately, holidays have been a thing of the past, unfortunately, at least abroad. So just a fun exercise to get people going and kind of, get the energy levels. But if you should be able to kind of move a pin on the device that you're looking at. And so if you put a pin on kind of your dream holiday destination, if you could be anywhere else in the world right now, where would it be? Hopefully a lot of people would say where I am listening to the Good Thinking webinar, but if not, we completely understand. So there's quite a few pins going on there as well. Hopefully this is just a good test to get used to Menti if you haven't used it before. Can see now quite a few popular destinations, fair few in Australia, South America as well. So this is a bit of a test of geography as well. I couldn't find a map that had any more granular detail than this, unfortunately. But as said, just to get you used to kind of using Menti, then this will be we've only got a couple of questions for now, just to make sure that we can tailor this session to what would be most helpful for yourselves as well. Map's looking really good now. We've still got a few more people joining who are probably thinking, what on earth is this? But that's okay. So I think, Yassine, that's looking great. So we can see that probably Australia and Central South America seem to be the top destinations. I haven't really been to either, unfortunately, but they would definitely be mine if I was putting my pin there. So I think without further ado, we'll probably move on to some of the slightly more serious topics. But so Yassine, if you could just skip on to the next role. So great. So we just want to understand a little bit more around, kind of your job role and what you do, and then that will help us tailor some of the messaging and make sure that we use this time to help you as much as possible, and make sure that Good Thinking can help you as well. So we've got a few things coming through. Again, if you've got any problems using Mentimeter, let us know. But it seems like people can get to grips with this quite quickly. So we've got the larger the text, the kind of more responses. So we've got a real mix by the looks of things. I might actually have to zoom in on my screen slightly to actually see all the results. We've got public health officers, mental health advisors, can see sort of CBT therapists. So great, loads of results there coming in, which is really helpful for us to see and understand. I'm trying to pull anything else out, but it changes quite quickly. A couple of project managements. I can see a social prescribing link worker in there as well. So yeah, hopefully for all the, thank you for your responses. So that's really helpful for us to understand. And I guess we offer quite a wide service that we'll explain and go into a little bit more detail later. But hopefully there's something in this webinar for everyone. And again, feel free to comment or use the chat pane if there's anything in particular that you'd like us to cover. So with that, and to keep up the pace, if we move on to the next question. So this is just to understand, how familiar are you with good thinking? So you should be able to see kind of a scale where you can rank your understanding currently. So it goes from kind of number 1 is, never heard of it, to number 5, which is, I use it all the time, super familiar with it. So just to help us understand kind of where the level is currently at. So looking more towards the never heard of it, which is really helpful. We can go into a bit more detail around some of the aspects as well. And thank you very much for coming to find out more as well. Fab. So hopefully that was got to grips with Menti, and it's helpful for us to see that as well and get a gauge. So we'll tailor our messaging to hopefully suit as well. I think that's all the questions. Am I right? Oh, one more question. There we go. So final one is what would you like to get out of this webinar? Is there anything in particular? So we'll just spend kind of 30 seconds or so. Feel free to type in, and then we'll see some of the results. And that, again, that will just help us tailor some of our responses. So we've got a few tips and advice, resource to refer clients to, more understanding about what good thinking is, better understanding. So that makes a lot of sense given some of the previous responses. Great, thanks Yassine. Thanks everyone for all your responses. So an overview of the resources available, we've got that in, we've got a lot of information on that as well. How I might be able to use it, practical tips and resources, how good thinking can help residents. Great, that's all super helpful, and hopefully that does align with what we've planned for, which is always a good start. So thank you very much for your time spent on that. It's really helpful for us to see. So I'll just bring up my screen again now, and we'll start to explain a little bit more about what good thinking is, and hopefully answer some of those questions that you had as well. So I think over to you now, Gemma.
Yep, thank you, Nicola. So now people, I'm going to give people a bit of a history of good thinking, but I'm probably the newest member of the good thinking team, having sort of taken it on quite recently. So I feel quite honoured to be doing it. But I was sort of reflecting before the session that, you know, our kind of first Apple App Store went live in 2008, and in 2015, the first iWatch kind of came into being. And sort of around that period, people were becoming much more familiar with searching online and looking for self-help and support tools. And I think sort of health leaders were also really keen to make sure that that sort of self-search online and looking for apps and using different things was also something that they were given or presented with the best support possible to help them manage their conditions and concerns. So around sort of, I guess it was around that time, it was around 2015, 2016, a small group of people got together and started to think about how can we make sure that we're harnessing this desire for people to find self-management tools with the available resources online that will really best help them in a way that is free and accessible to all. How can we bring that into being through an online system designed by and with the NHS for all Londoners and with the support of public health colleagues? And so it's from that Good Thinking was born, and it first went live in 2017. So it's been around for a little while, but it's been having a sort of, as with all kind of digital applications, it's been having a sort of a long period of gestation. And everything that we create on Good Thinking goes through a really important process of co-production with people experiencing different conditions, through clinicians, making sure that there's a strong quality assurance process to all the content that's up and on there. And we do a lot of engagement with Londoners to understand the things that they want to see on the site. And we also wanted to sort of make sure that the site is really accessible. We know that there are barriers to people accessing support based on their limited awareness and knowledge, or a lack of trust, or stigma, or cultural barriers. So we wanted to make sure that Good Thinking was designed in such a way as to overcome those barriers. We wanted it to be inclusive, we wanted it to be friendly, and we wanted it to be empowering and collaborative. And so we've created this online application that people can use. And it has now grown, I think, over that period into a really vital and wonderful resource for people. So as someone who started quite recently with the Good Thinking programme, I found myself already prescribing Good Thinking to friends, to family, to colleagues. And that's really what we want to try and encourage all of you to think about and do as well. It's a really powerful tool. It has many advice, tips, downloadable things. It's free to Londoners. You know, they don't have to pay for these apps. People can use it in a place that suits them at the point of crisis when they're most reaching out for help. It's a really strong opportunity to share a concrete tool as part of social prescribing, and social prescribing not just in primary care but across all the different organisations who support people, whether that be hospitals, whether that be schools, whether that be in employers, any settings really, but also to your friends and family. So we really want to use today to help you see what the kind of potential of good thinking is. We're continuing in that spirit of co-production. So we're continuing to develop this tool, add more to it each time, make sure that all of the resources on there are the things that people really need that can have the biggest impact for the people that you work with day to day. And we have an advisory group that helps to develop this, and that advisory group brings together some of the best leaders in public health across the health system, some really strong clinical thinking in terms of what's needed, and also in digital expertise and capability. So we're developing this for you, we're developing it with you, and we hope it's a really useful tool for you in your day-to-day practice. So I'm not going to say much more on the history than that, but I'm going to move on to the next slide, where I think we have a small video for you, which is going to just give you that quick introduction to what's on the Good Thinking site. Thank you.
In a world full of external pressures, where we are constantly on the go, it can be hard to switch off. London has the highest proportion of the population suffering from anxiety, with almost half stating they're anxious and a third reporting low levels of happiness. Good thinking supports individuals to look after their mental health in a way that works best for them. COVID-19 has exacerbated long-standing inequalities affecting Black, Asian and minority ethnic communities. Good thinking recognised a need for culturally relatable content and has since developed a suite of culturally competent resources for different faith communities across London. As with all of our work, everything is clinically reviewed and fully endorsed by the NHS. We have a suite of resources available covering stress, sleep, anxiety and low mood for both adults and children alike. Our range of resources allows individuals to choose a service that suits their preference. This could be listening to a podcast, watching a video, or reading a leaflet. Furthermore, we have recommended NHS apps to help individuals improve their mental well-being, which are free to anyone living or working in London. These apps, as well as all the resources, can all be found on the Good Thinking website. Good Thinking's user-focused, community-based approach, combined with clinically sound resources, enables us to provide the best resources to the most marginalised communities across London, enabling them to improve their emotional and mental well-being.
Thank you, Nicola, for showing that video. So that gives you a quick intro, and we're going to go into a bit more detail now on what are the resources that are available to you. So I'm going to pass over to Richard. Hopefully he's ready for the next slide.
Thanks, Gemma. And just going to give you a quick guide now to some of the ways we've been trying to bring together the different resources that might, as Imran described at the beginning, relate to particular areas of need, such as low mood, anxiety, stress, or sleep. And you'll see later on, in terms of the resources that we've been producing, that I think you could use yourselves or could share with a client or someone else you're working with. So we do a lot of listening socially in terms of what people are searching for online. And despite even the impact of COVID, these 4 areas of need are what people most often go onto Google search to look for support for. And in relation to each of these, we've got a number of different resources that can be helpful for someone to sort of both understand and then find personalized support for that particular area of need. So you'll see across these areas of sleep, anxiety, low mood and stress, one of the first things that people might want to do is a self-assessment. And this is a clinically validated based on over 20 years of expertise in terms of understanding how to ask the questions that help someone understand what they're struggling with better. And at the end of that, reasonably lengthy process of about 20 minutes. They will get personalized recommendations, and I want to emphasize here, for every level of need. So if somebody is on the verge of a crisis, they will get that advice to seek help. And actually during COVID, this was really helpful, particularly when people weren't sure whether they should be trying to see their GP or have a hospital appointment. The self-assessment kind of helped you work through what you needed. But we've got information there. You'll see across the middle groups, symptoms of anxiety, symptoms of mood disorder. Lots of people are not really aware of what they're struggling with, and just basic, what we might call psychoeducation materials to help people understand better can really help them on their journey. As Nicola was saying, we've got rich media in terms of podcasts. If you're tired of screens, hopefully not during this hour, you can listen to subject matter experts across a whole range of different issues and needs, from working from home and hybrid working in offices through to areas like mindfulness and OCD. And then we've also got videos, and there are many from different groups, including faith and belief groups across London, that produce those relatable videos. The apps I'll mention shortly, but the other thing that we've always been painfully aware of, and COVID again amplified our awareness of this, is digital poverty. And so we're always providing assets as well, resources in terms of the workbooks and other leaflets that can be printed off for somebody who may be uncomfortable going online, may not feel confident, or may just not have the device or data to do so. So we're also embracing the sort of need to provide offline resources as well. We could go to the next slide, please, Nicola. Just to tell you about the apps, as Gemma said, lots of people are still very interested in how they might use a smartphone or tablet to support their mental health. I think on TikTok it would probably be called self-love for lots of young people, but there are lots of things that can be very effective, that if you download them and stick with them, they will have a positive impact on your mood and anxiety. And what we've tried to do is not just make sure these are all up to the standards the NHS expects, and that's a continuing process, but also have a range of approaches. So you'll see here across the different areas, we've got a mindfulness CBT app that has been used in IAPT for people working in that area, that if people stick with it, will get recovery rates that are comparable to seeing a psychologist offline. My cognition is an interesting one, and I saw, Maria, your comment about this and the registration process, and I think someone from the team is mailing you if they haven't already to help support that. But this is basically a sort of brain training game. That's you think, what on earth is that doing there? But actually, when you dig a little deeper, it actually helps you understand how you're functioning in terms of your focus, concentration, but also it's kind of like a form of mindfulness. And for people who have been through traditional sort of psychological therapies like CBT, that's a different approach that can help them particularly feel calmer and get a greater sense of focus. My Possible Self is a very comprehensive mental health app with lots of different areas and videos and guides to support you in relation to stress, anxiety, but also other areas like substance misuse. And it's a really comprehensive app. Tomo is based on, if you've come across the therapy of behavioral activation, which is about how you don't necessarily need to talk about how you're feeling. You can just set goals and try to build new healthy habits. But those habits are doing the things that actually make you feel positive, that make life rewarding for you, which are some of the things we stop doing when we're feeling stressed and anxious or low. So Tomo's a great app, and there's a module called Reflection that's even good for helping you calm to get to sleep. And then we've also got ones for under 18s, again going to the best in class, we think, apps out there. And Move Mood, rather like Tomo, is using behavioral activation to help young people boost their mood and also become more motivated. So there's a whole range of apps there that we think are the best ones out there, free for Londoners, and there's confidence, and I think the sense that this will make a difference if you use it. And this I think sometimes our colleagues in IAPT think this is helpful because IAPT may often only be able to use, say, something like Silver Cloud. And if you've been through that, this gives you an alternative for somebody for whom that wasn't so effective for. If we move to the next slide, one thing we also want to touch on, which I think Gemma described, is that good thinking is able to respond to emerging needs. And if London wasn't a place where trauma was an issue before COVID, it clearly became one as the pandemic struck. And so we worked with the trauma experts at the Maudsley Hospital, particularly Caroline Harrison, who's a very experienced trauma therapist there, to actually develop a workbook that isn't a substitute for therapy, but it can be helpful for people who are struggling to cope with trauma, maybe on a waiting list, may not be sure they're ready. And again, it contains that sort of psychoeducational information that helps people who have been through a trauma even recognize they have, and even start to understand why they're feeling the way they do. So there's coping strategies within that, grounding techniques. And what's also really wonderful about this is we're also able to translate it into different languages. And following the situation in Afghanistan last year, have got this translated now into Dari and Pashto, which should be on the site very shortly. And you can imagine there may be other languages ready to be sort of for us to translate into those languages at the moment. So I think I'll stop there, Gemma, and I think hand over to Nicola, I think.
Yes, that's right. Thanks, Richard. Fab. So yeah, just to continue the kind of very high level overview on some of the resources that we've got on offer. Over the last year or so, we've been working to tailor content towards different communities across London. During the pandemic, it was found that that some people from faith communities would often turn to and seek mental health support from faith leaders, and maybe kind of as opposed to more traditional routes. So what we've kind of pioneered and piloted, and now it's become more of a business as usual kind of process, but we've used a co-development approach with local communities across London to create a suite of tailor-made wellbeing materials, all of which are based around the 5 ways to wellbeing, but this time they've been looked at through a faith lens. So each of these guides has been translated into the most appropriate languages spoken within that particular community, which is all based off kind of community advice that we've sought at the time. And to accompany each one of these leaflets, there's a suite of videos and animations featuring influential members of communities, and alongside which there's also kind of a full communications toolkit, which can be found on the Campaign Hub section of the website that Jess will talk about later. And then finally, all of these materials are endorsed by kind of faith bodies affiliated with each religion. So to give you a bit more of a flavour around, what that might look like for a particular sort of set of resources, if you haven't seen one already, we've just got another sort of slide here. So yeah, so to give you a better idea of kind of what this looks like, this is kind of some example content from the original pilot, which was the 5 ways to wellbeing and Islam. So you can see that the leaflet is translated into a further 6 languages, all of which are available online, as well as having printer-friendly options. There are 7 videos available which give a personal perspective on the 5 ways to wellbeing, and a full campaign toolkit which contains links to those videos and animations, as well as template social media messages and longer newsletter style articles, hopefully to make it as easy as possible for people to cascade these messages and work with people to kind of help them kind of improve their mental health and well-being in a way that maybe hasn't been as accessible or relatable up until now. I think the only thing I'd say as well is that, obviously these are leaflets, but there's also, as we mentioned, kind of videos and animation. So hopefully there is a way in which people can access help and information in a way that works best for them and suits their kind of own sort of preferences as well. And then we just wanted to touch on slightly. So so obviously not particularly nice topic, but unfortunately something that, you know, everyone has to go through at some point in their lives. But more recently, we've expanded our kind of culturally competent and community-based work by developing bespoke bereavement resources. So these set of resources are aimed at increasing people's awareness of different cultural and faith practices surrounding bereavement, and that really is aimed to enable people to have more empathetic conversations with those going through a difficult time. So I guess, you know, we're all probably, you know, hopefully you know, relatively familiar with some of the difficult things that happen during this time in your own culture or your own faith, but how do you support someone outside of that and be able to have kind of show those empathetic and intelligent conversations that you have a degree of awareness around that to help people. So to date, we have released guides for Buddhism, Sikhism and Christianity, and then the Islam, Judaism and Hinduism guides are due for release shortly. So that just gives a brief overview of some of the other resources that we've developed that are kind of outside some of the core sort of stress, low mood, anxiety and sleep, but actually are looking at things in a very different way and really embody some of the co-development and community work for which we really stand for at Good Thinking. So I'll hand over to Jess now, who can talk a little bit more about some of our resources for children and young people.
Thanks, Nicola, and thanks everyone for your time this morning. It's really great to see so many of you here and from such a wide range of different backgrounds across the mental health pathway. So we launched the section for children and young people this time last year, so March 2021. We were really pleased to be able to do that a few years later than we wanted to, following the launch of Good Thinking in 2017, but amazing that we were able to do it. And in the spirit of co-production and co-development, we worked really closely with Partnership for Young London to ensure that the resources that we were hosting for young people felt relevant, felt usable, and felt helpful to the population in London. We continue to work with Partnership for Young London and their programme of digital health ambassadors when we're creating and testing new content. So you'll see hot off the press some examples of the 5 ways to wellbeing and children and young people on the right there. They will be published this month, so they're not quite live yet, but we've been through a process of design and developing the actual content and the written word on those posters with the digital health ambassadors and Partnership for Young London. So they told us that they wouldn't want a leaflet to be printed out, which is why we've kind of changed this format slightly from the work that you saw earlier that we did with faith communities. So we've got these 5 posters and there'll be accompanying videos to go with them as well. So there's already a huge selection of resources for children and young people on the website. So there are the apps that Richard mentioned. So it's not just Move Mood, there are others available as well in the library on the website. There are a number of podcasts, articles, and some of these are fairly generic kind of explaining articles, but they go into some specific topic areas such as eating disorders, how to cope with fake news, misinformation. So there's a huge range on the website. On the next slide, so I'm going to talk now a bit about how Good Thinking can help support you. So on the next slide, I won't dwell on this too much, but this just kind of shows how the resources on Good Thinking can support people that work in the mental health landscape, but also for Londoners themselves that are at different points of need, and how Good Thinking resources can support at each stage. So this can be from Londoners seeking support themselves independently, just Googling stuff, right up to some information about crisis support. And this is where we really want to continue working with people within the mental health pathway to think about how we can target resources, how we can communicate them, how we can work with people in IAT services, for example, or in primary care, to make sure that we're focusing our resources in a way that's most helpful. So on the next slide is a bit of work that we've been doing recently that will be published soon. So those 1-pagers on the right, Richard and I spoke to a group of GPs who were aware of Good Thinking and enjoyed recommending Good Thinking to their patients as they were seeing them, but they don't have the headspace to remember exactly which app will help which person. So these 1-pagers give a kind of high-level overview of the different common mental health conditions, as well as the very specific resources that would support someone going through that. So these will be published as part of the next steps to this webinar. There'll be a whole kind of toolkit, including these slides, including the recording, including the one-pagers that we'll be publishing soon. And they'll go onto the section of the website that you can see on the left there, our campaign hub. So each time we develop a new resource, we work with our comms colleagues to have an accompanying comms toolkit. So that will have assets for you to tweet and use on social media, copy for you to use in newsletters, and yeah, other helpful kind of messaging. And yeah, we just want to kind of say to you as well that we'd really love your support agenda to get good thinking, really investing in our comms engagement and proactive outreach into next financial year. And we're going to be recruiting a specific person to support us do that. But yeah, we hope that this is a first step for some of you on the call, getting a bit more familiar with the service, with what it offers, and would love for you to help us share it. So that's it for my couple of slides. I think I'm handing back now to Gemma.
Thank you, Jess. That's great. So kind of that hopefully has been a really helpful introduction to the resources. I'm really excited to see people in the chat box saying they already want to share it, but also some of the questions around new content and things that we might think about putting on there in the future, which is why we said at the beginning, you know, good thinking is a piece of work for all of us, for all Londoners, for all of you. It's about our co-production with you to make sure that we're making it the most useful and helpful resource, and really targeting it in the right way. But we're going to sort of come to a Q&A section of the session now, and I'm going to ask the panelists or the people who've spoken already in the team, and Imran, who's our chair of our kind of main Good Thinking Advisory Board, to rejoin. And I was going to kind of pick out, obviously, if people have any questions for the group, if you could just pop them in the chat box, that would be incredibly helpful. And perhaps while you're doing that, I'll just sort of ask a question myself to the group. So it's so hard to draw a line, isn't it, on all the different tools and resources that you could put in this place. And obviously there's a sort of a development process that you go through. And I wondered, Jess, whether you could describe perhaps the development process a bit more so people understand sort of from an idea to actually it coming into being. How do we sort of secure that in the Good Thinking tool? And perhaps Imran, you could sort of give us a bit of an overview of how we decide what we should include, and perhaps what we don't include straight away, or kind of what's more in a development step. But Jess, do you want to just describe that process in a bit more detail?
Yeah, of course. Thanks, Gemma. So it varies slightly depending on what kind of resource we'll be developing. But once we've agreed a priority area, and Imran might come on to talk a bit about how we do that and how we work with our stakeholders, work with those that fund us to agree on priorities for the year and for our work plan. We will either work with community partners, such as with the 5 Ways to Wellbeing and the bereavement resources that you saw earlier, or with subject matter experts. So, for example, with the trauma workbook, working with clinicians in SLAM, and Richard as our clinical director. And so we would develop a written piece of content or a leaflet, depending on what's needed. And we would always test that back in a cyclical process with our partners. So with our community partners, with our subject matter experts, we work with a copywriter as well to make sure that we're pitching the language in the right way for each resource that's developed. And then we work with a specialist design team as well. So hopefully you've picked up from some of the images through those faith-specific, culturally competent resources, that's again a cyclical process of testing that design back with the communities or with the experts that we're working with to make sure that they feel representative of those communities, and that it won't feel jarring for people to use, but they're looking at that and it feels familiar. So that again will go through a sign-off process. It will go through a clinical sign-off process, a sign-off of a final version with whichever partners we've been working with, and then we'll publish it alongside the comms toolkits that I mentioned. We're also doing a really exciting thing with some communities in Newham to think about how we evaluate those resources once they've been published. So we're trialling a model of peer evaluation in Newham. So we've trained community leaders within Newham to ask questions of their community members and people that they're working with to see how helpful those resources are, so that we can always be learning and think about that when we come on to develop the next piece of content.
Great, thank you. And Imran, you just disappeared off our screen.
Hi.
Great.
Hi, thanks, Jim. So I think in terms of where good thinking wants to position itself, it's ever since 2017, we've always wanted to really focus in on those really common mental health conditions. So that's, if you like, our core business, our raison d'etre. But and clearly there's a huge need for that, and good thinking alone won't be able to address all of those issues around anxiety and stress, etc., that are out there across London. But I think the most important thing is that, therefore, how do we maximize the accessibility to these tools and make them really effective and meaningful for local people? That means refreshing the content, whether that's to deal with issues as they arise. So I think in the chat we've had someone talk about Ukrainian refugees. We've been through COVID, or it's about thinking about how we reach out to particular communities who need a more bespoke and tailored message. And I think the work, which has been absolutely amazing in terms of the co-production with faith communities, is a really good example of that. So I think good thinking will generally really stick with trying to address those 4 key areas in terms of the common issues around mental well-being. But actually, we want to constantly change according to the need and according to how we reach into different communities as times change. So I guess that's, I think, some of how we think about prioritization when we think about work plan.
Great, thank you. And Richard, you've been answering a couple of things in the chat box, but it might be worth kind of talking to the group about this connection between GP prescribing, EMIS System 1 and the Accurex text messaging system. Can you tell us a bit more about that?
Yeah, I think for those that are asking the questions about those GP electronic record systems, that we are, I think technically, Jess, we are part of the EMIS apps library, so our apps can be prescribed through EMIS, and I don't think we've just had the capacity to progress that with System 1. But what we were finding, particularly over the COVID era, was that GPs were finding systems like Accurex and iPlato, I think is one of the other ones for broadcasting, to patients for a particular practice, that we've sort of developed those very short, snappy sort of communications, but that includes the URL, the link that takes you to specific resources. So if a GP is, say, meeting with somebody who's struggling with anxiety, they can use the Accurex template for that to send a text message that then gives direct links. And so that person doesn't have to go to the homepage of Good Thinking and start to look around, because we recognize that that can be overwhelming, and especially if you're anxious and not always comfortable with technology. So we're trying to make it as easy as possible for practitioners, and GPs are a very important group for us, to be able to get that message across, because we know the trust of that message coming from a professional has a really positive impact, and people are more likely to use these resources that will work if you use them. So I hope that gives some background to that, Gemma.
It does. That's fantastic. There was a question in there about, are we going to train other community leaders from other local authorities? Well, we want everybody to understand how to support people in accessing and thinking about using good thinking. So that's something Jess mentioned around our marketing and communications this year, but we're also thinking about the training aspect. And we want training to be really accessible. So a bit like we're recording this webinar to share more widely, we'll be thinking about the ways we can make training very accessible so that people can access it online. And we certainly want to be going out and meeting with different community leaders and others to think about, to promote it and to talk to them about how they can use it with the people that they're in contact with. So yes is the answer to that. Yes, we want it to go far and wide. And I think kind of the other questions, people have got so many ideas for things that could potentially be useful to have as a resource on good thinking. I particularly noted learning difficulties, but also for carers and for and their mental well-being. And we do know that obviously these issues do present with for individuals with a higher level of stress, mental health, difficulties managing other aspects of life because of those challenges as well. So they're absolutely things that we would consider ripe for good thinking, extra resources, and I think the only thing that sort of challenges us is sort of how many can we do at once, and in what time frame and with what resources. And so as Imran said, our raison d'etre is to get it absolutely right in terms of managing well-being and you know, sleep, mood disorders and so on, but over time, you know, we would love to ensure that good thinking is the home for accessing resources like this for a whole range of populations where we know that you know, mental health is a particular challenge, perhaps because of their circumstances or because of their conditions. So that widening over time, I'm sure, will continue to grow alongside this widening of opportunities to promote, advocate, and use it, and opportunities for us to work with you to make sure that it is absolutely meeting your needs as IAPT services, as primary care teams and others. So we're really excited that people are here today to talk to us about it. So yeah, keep throwing ideas at us because we will gather them, we won't forget them, and they'll form our kind of ready list of what more is needed on good thinking. Jess has put some stuff in there, links to the Children in Your People work, which has been a particular new feature, really important feature, that opportunity to make sure that good thinking is for all Londoners, for all ages, right through from your children to retirement. And we even have the bereavement support tools on there for people as well. So it really is covering a vast number of populations in London. So I'm going to finish the Q&A there and add back and hand back to Imran, who's going to give us kind of a final word on the session today, and perhaps sort of encourage a task for you as you go back to your day-to-day lives. Imran.
Thanks, Gemma, and thank you, colleagues, for your time. I mean, it is so precious these days, isn't it? Actually, but this is wonderful. Actually, it's one of the few moments where I actually enjoy doing the stuff online, actually, as opposed to face, because actually there's a fantastic opportunity to speak to so many of you. I think at one stage there was 70 people. I'm not quite sure how many we've got now, but fantastic to speak to so many of you today. Thank you for your time. Really valuable questions, and I think, team, we will make sure that we really get some that's really helpful for us, particularly around some of the really practical questions about how you can access good thinking from primary care. So I think we will pay particular attention to those, and I think equally as well, some really interesting comments about some areas for us to think about as well. So that's been really, really helpful. We will be sending out our toolkit, as Jess said, so please do keep a lookout for that, and please do share. The team are very contactable, and if anyone would like to take up a conversation with us, with any of us really, please do get in contact. I mean, we'd really welcome a conversation, and particularly if you think you'd like a conversation with the Good Thinking team about your area and how good thinking might contribute further to development of mental health strategies in your area, we would definitely like to be involved. But anyway, let's wrap it up there. Thank you so much for joining. We've certainly learned a lot, and I hope it was really, really meaningful and useful to you. Thanks very much to Nicola and all the team for putting it all together, and thank you for your time. Take care, colleagues. Bye now.